Assalamu alaikum. Welcome back to Dr. Tariq RYK. Today our topic is about the anatomy of the upper limb. In anatomy of upper limb, we will see each and every bones in three-dimensional view. And let's start our topic. If you are new and first time in our channel, start subscribe our channel and on the notification bell to get updated videos. Let's start topic. Today we will discuss about the clavicle or collarbone or beauty bone. See, this is clavicle. This is the anterior view of the clavicle. We will see each and every landmarks on the clavicle that are clinically very important. Basically, clavicle is the long bone. It has shaft and two ends. One is lateral and one is medial. Lateral end also known as the acromial end, and the medial end is known as the sternal end. It has the medial shaft. In front view or anterior view, clavicle has some important features or important clinical points. If we see from left or medial side, we will note this is the sternal facet or sternal groove where sternal attach with the clavicle, and this is the sternal end of the clavicle. And this is here is a tuberosity in clavicle known the costal tuberosity. Here the first rib attached with it. This is the shaft, and in shaft inside is a groove known as the subclavian groove, where subclavian vessel like subclavian artery, vein, nerve pass through this groove below the subclavius muscle. And here is tuberosity known as the conoid tubercle. In conoid tubercle, coracoclavicular ligament attached. And here is another line or groove known as the trapezoid line or trapezoid groove. In this, some fibers of the trapezius muscle pass through it. And the lateral end, also known as the acromial end, this is the acromial facet or groove for the acromial process of the scapula for its articulation, and this is the acromial end. This is the front view of the clavicle. Clavicle, as we know, also known as the beauty bone, because it's the most prominent bone and is the only bone that present in the horizontal plane in the human body. All other bones, long bones, are present in the vertical, but only clavicle is the long bone that is present in the horizontal plane. This is the anterior view. Now let's start posterior view. This is the posterior view of the clavicle. In posterior view, what and which part of clavicle we can note? This is the sternal facet or sternal end. And here is a tuberosity known as the costal tuberosity. And this is shaft part. Middle is shaft. And also in shaft we have groove known as the subclavian groove. And here is tuberosity known as the conoid tubercle. Coracoclavicular ligament attached here. This is medial side. And here is a trapezoid line or trapezoid groove where the fibers of the trapezius muscle attach. They have their insertion in trapezoid line. This is the posterior view. Now see the lateral view of the clavicle. This is the lateral view of the clavicle. In lateral position we see clavicle like this. This is the acromial facet. This is the acromial side. Here we see acromial process of the scapula attached in this part. And see now the medial view. This is the medial view. In this side, the sternum attached with the clavicle. This is the sternal end, or this is sternal end of the clavicle. This is the medial view. Now see the superior view. If you see upper side or superior side from the head, we will see clavicle like this, concave. And if we see inferiorly, we will see like this. This is inferior of the clavicle. Here is costal tuberosity. This is the medial part or sternal part of the clavicle. Here is groove for the subclavian vessels. Here is the tuberosity known as the conoid tubercle for the coracoclavicular ligament. This is the inferior of the clavicle. As we know, clavicle also known as the beauty bone, because in women the clavicle is most prominent bone, and it is used in the woman imagine as a beauty bone. This is anterior view of the clavicle. I hope you have understand. If you have any question or any confusion about this topic, you can make comment.